Types of hypothyroidism: primary hypothyroidism and secondary hypothyroidism. Primary hypothyroidism occurs due to the destruction of the thyroid gland, autoimmunity being the most common cause, or any medical intervention such as surgery, radioiodine, or radiation. Secondary hypothyroidism occurs after pituitary or hypothalamic damage and results in insufficient production of TSH. In secondary hypothyroidism, thyroid gland is normal. It is due to the deficiency of the TSH. The thyroid is unable to function properly and release T3 and T4. Signs and symptoms of hypothyroidism: depression, mood swings, constipation, hair loss, dry skin, fatigue, changes in menstrual cycle, swelling of the thyroid gland. In prolonged and untreated cases, it may lead to heart disease, infertility, joint pain, and obesity. Diet for hypothyroidism. First, we will see what all foods we should avoid. First comes goitrogenic foods. Goitrogenic foods means the food which cause swelling of the thyroid gland. Goitrogenic food do this by interfering with the iodine uptake of the thyroid gland. The lack of iodine causing the T3 and T4 levels to go down, hence causing hypothyroidism or goiter. The main goitrogenic foods that you should avoid is soybean, tofu, etc. Because in soybean, there is a certain chemical like isoflavones. These isoflavones inhibit the activity of thyroid peroxidase, which is essential for the synthesis of thyroid hormone. The next is cruciferous vegetables, which mainly contain broccoli, cabbage, cauliflower, etc. These blocks thyroid's ability to utilize iodine. Whether you have iodine or not, the thyroid gland cannot utilize the iodine. Next thing to avoid is gluten, mainly wheat and barley. Because if a person has subclinical hypothyroidism and celiac disease with it, because this gluten will start producing antibodies against the thyroid gland, especially in persons with celiac disease. So, if a person has celiac disease as well as subclinical hypothyroidism, having a gluten-free diet for a year may bring your thyroid levels back to normal. Then, foods such as cherry, plums, almonds, apricot, and strawberry may also interfere with the activity of your thyroid gland. Pregnant and nursing women should also avoid goitrogenic foods because maintaining a healthy level of thyroid hormone is very vital for the developing child, especially for the brain development of the child. The main food you must avoid is processed food and processed meat because they are high in chemicals, inflammatory compounds, and trans fat, which cause high inflammation in our body, which in turn cause hypothyroidism. Food which we should have in hypothyroidism: flaxseed oil 1 teaspoon a day is very good for thyroid function. Selenium rich food to support the thyroid gland like eggs, Brazil nuts, brown rice, etc. Zinc rich food such as mushroom or pumpkin seeds. Iodine is very essential for the proper functioning of the thyroid gland, especially in hypothyroidism patients. Most people take iodine supplements. Too much iodine as well as too low iodine both are bad for the thyroid gland. So try to take iodine from food instead of supplements. Seaweeds, fish, iodized salt, dairy, eggs are good sources of iodine which we can include from our daily intake. Fish is a good source of omega-3 fatty acids. Omega-3 fatty acids reduces inflammation. Especially sardines are a very good source of omega-3 fatty acids. Food that are rich in iron, for example spinach or some other green leafy vegetables, is very rich in iron and is necessary for the proper functioning of thyroid gland. A physical activity in any form is highly recommended, especially to increase the metabolism.